Hello, hello, hello. Welcome to All Stock Trade. So, yeah, kind of a late live here, but wanted to throw this video out. So, we're going to be talking about small caps today, talk about United Healthcare, Humana, what's going on with Clover Health, more specifically, what's going on with Andrew Toy's recent message 7 hours ago. And yeah, so first off, hold on. Let's go ahead and hit this one right now. So overall, yesterday and the day before, the markets were down. We made a video talking about how the ISM manufacturing came back, and that spooked the markets. But we believe that this was a buy the dip opportunity. As you can see, there's a huge gap on the small caps now. We believe that this gap will be filled. Ultimately, Federal Chairman Jerome Powell will be speaking tomorrow, and ultimately, it's 1 a.m. Eastern time. So it's actually 10:30 here. I'm on the West Coast, so we're on the totally opposite sides. So I'm on the West Coast, guys. I'm in Arizona, so we don't do daylight savings or anything. So we're pretty early down here. All right. So, but hey, enjoy the video. 1 a.m. baby, right? Enjoy it. So, we have a gap today on the small caps, which we know it's going to get filled. The federal chairman is going to be speaking this Wednesday through some meetings, and ultimately, we do believe he's going to extend his dovishness onto the markets. So we have that to look forward to. Also, next week we have the March CPI report, which will be coming off on April 10th, 8:30 a.m. Eastern time, just like with Maluk, right? Was has a time zone here, but interestingly, if you go to the 30-minute time zone, we're actually in the oversold area now. So this is setting us up to be in a really good position. In fact, if you were to go back, every time we hit these oversold conditions, we always tend to bounce back up. So I do believe this is the buy the dip opportunity. Another thing I want to now shift to is kind of Clover, Humana, United Healthcare. So you saw today, Humana dropped. Humana dropped like crazy. You know, we had a little bit of buy the dip opportunity there. We don't know if it's a buy the dip opportunity, but we have people thinking it is. I need to do an intrinsic value calculation. But ultimately, if we were to kind of go back to weeks here, and if we were to essentially go back down here, and then we go from 2014 to 2024. Oh yeah, I'm PT like you, Bay Area, baby. Hell yeah, man. West Coast for life. You know, I love West Coast. Okay, so what do we see here? Well, the pandemic was right over here, guys. Right, the pandemic was right here. We're starting to get prices that are near the pandemic for the. In fact, let me just make it bigger for you guys so you can see this. We're starting to get prices that were like in the pandemic. In fact, we are more oversold now than we were in the pandemic, which is insane. Usually, historically, whenever prices are above the yellow line, the 50-day moving average, it's usually hedge funds and institutional investors that can drive up the stock price like that. Institutional investors left around November, and you could kind of basically see that some of them dipped out even here. Most likely, probably before the results even came out, because they knew what was going on. So this is probably informed institutional investors, and then they realize, and now institutional investors are popping out. But interestingly, if we were to zoom out here, guys, we're getting prices that we haven't seen since like 4 years ago. I mean, we had maybe something down here that was met by a quick buy, but we're lower. I mean, we're here. We're like near 2020 levels now. Okay. So that's a huge downfall there. Now, if we were to look at, and this is Humana, right? If you go to, this is what disruption looks like, right? We're starting to, now, hold on. Actually, let's go back to Humana. Interestingly, Humana crashed from its 50-day moving average, but even below down to its 200-day moving average. So this is on a downtrend now, and we don't know kind of how long this is going to take. Like this is like, you know, this could be a buy dip opportunity, but we need to go ahead and figure out what is the gross margins going to be, what are they going to be doing, how is CMS going to basically change. There's a lot of uncertainties here, right? Now, for United Healthcare, they're just tickling a little bit. They're still above the 200-day, so they're kind of jittery. Again, 2020 levels were down here, so they're still not near 2020 levels. So we're gonna have to see if this is gonna be like Humana. I'm sorry, yeah, like Humana. And if you go ahead and take a look at LA Alignment Healthcare, well, yeah, it's been going down, and this is more institutionally adored. The question is I feel like they operate more like the incumbents than Clover does. Because interestingly, even with all this down, I mean, like billions of dollars is flowing out of Humana, and we are breaking down levels of these resistance, and maybe now we can move this down here now because it seems as this is a supporting line here. So potentially we might rebound. So we'll see if this is gonna be the thing, and then we could break down or break out on the next earnings report here. But so yeah, so let's go ahead and go from there. So you could see that the last time we're reaching 2020 levels. So I showed you from the technical analysis charts here, but oh yeah, banks are going to be doing really weird. They're going to be doing really good because no one wanted to be in banks last year, and this year is going to be different. So yeah, if you looked at my our stock terminal analysis, we believe that financials are going to do well. Financials and healthcare, right? So, sorry, not financials. Sorry, financials and small caps, right? And then other aspects as well too of healthcare, like Ozempic and whatnot. So, so now that we talked about this, let's go ahead and divert attention here. So, we were talking in our stock terminal here regarding what was Toy and Andrew Toy talking about here, and well, we're gonna go into this post right now, but just wanted to give you my thoughts, our thoughts. Um, so like, so I'm in healthcare, right? I'm gonna be a physician, and I can't help myself but recall back when I was in my family medicine rotation. And you learn a lot on the job, right? So I was working at a private practice, which I'm so thankful for, because I was working at a practice that that simulates um what Clover wants to target. You see, if I were to work that Banner family practice, I wouldn't have really gotten this. It's more institutionalized. Banner supports everything. So it wasn't I got a good experience. Even though I'm not interested in I'm more of an academic. It was nice to see because of its uh how the business is ran, So I remember attending the meetings. I don't know, I told you guys before, but I attended the meetings of how they want to code, how they get paid, X, Y, and Z. And during the meetings, at the end of the meeting, I said, guys, it's interesting. You guys use Epic, but there's something called Clover Assistant. It actually does a lot of the things that you guys um want to do. And they said, have them come here and give us a meeting. We need help. The problem is I haven't reached out to Clover to tell them this, but the problem is Clover left Arizona. So I don't think so that's why I didn't really pursue it, because that was when Clover was leaving. And I was like, oh shit, okay, well, too late now. So, but interestingly, giving you my experience, I remember that because like how do I say this? Like, it's good to have an experienced doctor, because the doctors, have seen a lot of cases and whatnot. And we try to simulate the questions. Like every medical student that graduates, like I'm by the time I graduate med school, I probably have done 15, 20, 25,000 questions. No, probably 30,000. That's a lot, right? Each question takes about a minute and a half to answer, and it takes about 5-10 minutes to review. So you do the math. And I use the speed reading. So I actually do all the questions, which is pretty crazy. So a doctor, so what's the difference between a new doctor and an old doctor? Well, an old doctor has heuristics, pretty much developed his neural network. It's like a machine at diagnosing, right? Really great, really good. The thing is, who knows more? the new doctor actually knows more than the old doctor. Um, and so I was working with it's really beautiful. It was a beautiful like moment. I was working with a physician that graduated from my med school back in the 60s. He's been practicing medicine for over 50 years, okay? And here I am, and I'm not a normal medical student. I'm a physician. I'm a medical student scientist. So I'm heavy on the research. So by the time I graduate med school, I'm probably going to have over 20 peer-reviewed publications, which is pretty wild. If you look at the overall average of NRMP data, I'm probably going to be in the 50s to 100s versus the average is around like 10, maybe 2 or 3, right? So what I'm trying to tell you is I'm a big expert on the cellular molecular processes of medicine of disease. One of my masters is in cellular molecular mechanisms, right? So I have a big deep understanding when it comes to the pathophysiological sequences of disease. Okay. And my brain is fast, and I have the opportunity to look at the data versus the 80-year-old physician. You think he had that, there's this form of cognitive decline. There's a form, he's a genius, but obviously, like, you have a Lamborghini, and you have a Lamborghini from like the 60s. Okay. So there's differences in speed here. And the Lamborghini from the 60s has over 15, 20 patients to see. Okay. Versus me, I'm seeing all the patients, but I have no liability, right? I'm there to learn from him. So what I did was, as he was talking to the patient, after I spoke with the patient and did the workup, I went on the patient's chart because I have that opportunity. I have that time to take advantage because doctors sometimes don't have that opportunity. So think of me as the Clover assistant. I was looking at all of the patient's data, and I was watching the questions that my attending was asking. And then my attending at the end of and I really like he did this. He said, my attending asked me, he said, so do you have any additional questions? I'm like, yes. I'm like, you have decreasing GFR rates. Your GFR rates are going down. We need to give you X, Y, and Z and X, Y, and Z. Have you been taking these medications? The medications I'm referencing is lisinopril, beta blockers. These drugs have been known to, especially lisinopril, is renal protective, right? It helps with the kidneys, and other things I've looked at was cholesterol levels were increasing. Why were they increasing? Because sometimes the patient comes in for X, Y, and Z, but the physician doesn't have time to look through, although he should. But the reality is they don't. Some do, and I hope they continue doing it and not get burnt out. But I spoke to him and I said, by the way, a lot of your patients are coming with decreasing kidney. He's like, yeah. He's like, I'm trying to do my best I can, but like look what I have to do. And he showed me his email lists, and every time a patient sees another provider, he gets a ping, but he has to physically go into that inbox and read it and figure out how to take that data and integrate it with his own practice, which is family medicine. Okay. So this goes back to what Vivek was saying in regards to silos. Okay. So this goes back to what they were saying on the discussion of the silos. So a silo is its own little thing, and there are multiple silos that are separated. Okay. So let's go ahead and talk about this. So let's say you have a patient that unfortunately is, stage 4 or 5 chronic kidney disease, and they need dialysis. So that patient is going to have an intimate relationship with nephrology, right? They have to, because they need to get dialysis every week Depending if it's peritoneal, then they get it every night at their house, right? So what ends up happening is in the normal incumbent land of insurance we live in is that the family medicine doctor is living in the silo of his own business. The nephrologist is living in the silo of his own business. The problem is the silos between family medicine and nephrology team, they don't communicate. And sometimes they use a different electronic health record, such as Epic versus Cerner. Okay, you see where I'm going with this? So nephrology has its own silo, and then family medicine has its own silo. And they both use different electronic processing systems to capture their data. Okay. Now, obviously, we know that people in their seniors have more than one chronic issue. So the patient also sees an endocrinologist. They also see a cardiologist, because let's say they have AFib, right? So now cardiologists, endocrinologists, they all use different let's say all of them use different types of electronic health systems. Do you think the nephrologist has a good relationship with the family doctor? Yes, if they're good. But the nephrologist is booked because the nephrologist has a bunch of seniors about to die of chronic kidney disease, right? So, of course, they're not going to be as entwined with the family doctor. You think the nephrologist is going to be in contact with the cardiologist? Of course not, because they're busy with the kidneys. Same thing with the cardiologist. Are you starting to see how shitty our healthcare system is? Because it's broken. Okay, I don't like it's guys. It's bad. I'm going into neurosurgery. I'm applying to neurosurgery next year. I'm telling you, it's broken. This is a broken healthcare system. Okay, so now we know the nephrologist and the cardiologist and the endocrinologist, they don't even talk to each other. Heck, and here we have the family doctor that's watching this tsunami of this patient literally needing help. And he's trying to gather all this information from all these different silos. Okay. And in the insurance company, they don't help bring in the silos together. Even though they have the data, they don't help the family doctor. They don't help the physician with the bringing in the silos. They make the physician do the work. Now let's go ahead and contrast this with Clover Health. You see, Clover Health, they make the doctors use the Clover Assistant. So then now you have a family doctor utilizing the Clover Assistant. Then the patient goes to the cardiologist. Guess what? The cardiologist is using the Clover Assistant. Then the patient then goes to a nephrologist, and the nephrologist uses Clover Assistant. So what do you have now? You have an integration of the data all in one place. And you have generative AI that summarizes, if you look at their last Clover Assistant debut, they showed how they are using generative AI to summarize unstructured clinical data into structured, because AI does that with no hallucinations. Okay. So now here is the family doctor with Clover Assistant. And now the family doctor, the Clover Assistant prompts him and says, hey, did you look at this? By the way, did you know his GFR is downtrending? By the way, you know his cardiologist actually ordered this test? Do you want to see it? Well, yeah. So I don't have to order it. And what's happening is that there's not a repeating in tests, which decrease costs. And the family doctor, those costs are given back to the family doctor. So the family doctor is not pressed to order a bunch of tests. Because when I was in my family practice, there was a lot of emphasis on upcoding, right? Which I don't agree with, right? But again, that's the reality of things. Upcoding to make money because the insurance company has made it to where they try to take more money from the physician and the physician can't survive. Versus Clover is like, no, let's do honest coding and we'll help you code and you'll still make more money than that of another insurance company. So I know this was a very long-winded explanation of the silos, But if you go ahead and take this and go give it to Vivek, he's going to say, I 100% agree with Albert. Okay. All right. So now let's go ahead and let's turn to the LinkedIn post here. So he's been getting a lot of pings about what happened with Medicare. Great. Okay. The biggest thing here is a lot normal. So okay, this is the biggest thing. Honestly, this sentence here. Okay. As a quick summary, CMS set the rate at the same amount as the previous advance rate notice, which is relatively rare departure from the norm. Normally, CMS is conservative in its initial notice, then revises its rate upwards. After that, they choose not. After that, they chose not to do that in this case. So, which is why this huge drop right on April Fools. Right, there's a huge drop. And now, Humana used to be a $50 billion business. Now it's a $36 billion business. $15 billion pretty much left it, right? A little bit more than that, 15, 20 billion, right? Because they used to be 55 billion. Because remember, this, if you don't remember, this was a $500 stock, right? $528. Okay. So what happened, right? So what's going on with what Andrew Toy's saying? Well, you remember in his earnings call, he said that as the big players are going to be retreating, we're going to be doubling down. Well, the thing is, we've realized that Humana and the incumbents, honest to God, they just can't handle how expensive these seniors are costing. And these PPO plans are just really expensive for them. Okay. So it's expensive, right? So what they were hoping is CMS would up revise, but they didn't. So now what you're going to do is Humana, in order to survive, they have to essentially cut back on what they offer. Now you tell me, as the patient, who are you going to choose? And this is going to go back down to this one. Who are you going to choose? Ultimately, Clover's advantage sits around believing the future of Medicare is hybridizing the benefits. Vision, dental, groceries, and a wide network of original Medicare. This rate notice emphasizes why we're in a, they're in a good place. Okay. So like I told you with Intel and AMD. So there was a time where Intel was the behemoth of the behemoth, right? They were the behemoth of the behemoth. And it was this time point here. This one right here. This one right here, where Intel dropped 35% from January 24. Okay. Look at January 24. Oh, not AMC. AMD. January 24. Right here. Intel dropped 35%. AMD went up 230%. It's disruption. All right. So we believe that we are starting to see, we've been waiting for this. I've been waiting for this for quite some time, right? I mean, it's about goddamn time, right? I'm getting old over here. So, and I'm getting tired too, guys. So now that we're starting to basically see here, this drop, okay? And now money is being circulated in other avenues, and Wall Street is like, we need to reevaluate because we have a lot of new players in the game, and these new players could be the next new incumbents. You guys feel me? And I think Clover is right. Perhaps, we do know there could be a SaaS alternative, which is great. But potentially, maybe them being an insurance company was actually one of the smartest things they could have done. That was the hardest part, in my opinion. because Humana makes around $70-80 in revenue, 70-80 billion dollars in revenue. That's a lot of money, guys. If Clover was at Humana's level, just as of right now, at $35 billion, $39 billion market cap, that's like that's a $70 stock price if Clover became the next Humana. This is a long-term play, guys. This is a long-term play. And if Clover is the winner, what's crazy is that we're the only people. We're sitting here. It's 10:48 p.m. in Arizona. It's about 1 a.m. Was it 11, 12? Yeah, 1, almost 2 a.m. in Eastern time. We're sitting here talking about the next millionaire, billionaire making stock, guys. And that's impressive, right? So, if this stock hits what I believe it is going to hit, all you motherfuckers listening right now are going to be one rich motherfuckers. I'll tell you that. Excuse my language, but you guys are going to be rich as fuck. Okay. Now, again, being humble, life is not about money. Okay. Remember that. Even though money helps, remember that it's always important to be grounded, because you can't take nothing with you. Right. I always like to humble myself because, I've done really well in my life, right? You have to humble yourself, right? Because this here is all meaningless if you're gonna die tomorrow. A bunch of lines and shit, right? It's what you do with the money. Speaking of which, let me tell you what I'm doing. So in my nonprofit, we have over. In fact, let me share with you. And then I'm gonna go over the comments right now here. Let me just share with you because it's always nice to share with you guys because I just want to get you a little. You guys need know a little bit more about me. So this is what I like to do on my free time. I like to help people. And that's just who I am. I like to go to the beach. I haven't gone in a long time, but definitely one day. Hopefully sooner than later. So here's the Global Neurosurgical Alliance. We have about 514 followers. We have over 500 employees now. 500 researchers, guys. Okay. And what I'm excited is this gentleman here. This is insane. So we just got a paper accepted in for publication. And so, yeah, so let me just kind of let me go ahead and so let's start over. So let's go ahead and go to PubMed. And it's like NIH database, the National Institutes of Health. And if you type in my name, these are all my publications. So one, if you go, let's say here, I'll give you an example. And you go to free text, you can see that this is one of the publications. Here's me. I'm the boss, of course. Your boy is the boss, and here's the research, and here are all the citations, right? So, I helped this gentleman here, and the reason why I'm very proud of this is, this gentleman is Palestinian, right? And you know what's crazy is when Russia invaded Ukraine, the astronauts from in the International Space Station between Russia and the United States, they were still together, right? They didn't let their countries' differences stop them because they know that what's happening is not a reflection of who they are, right? So it is an honor to have both Israeli scientists and Palestinian scientists work together. Okay, this to me is an honor because science knows no boundaries. It knows no flags. It knows no boundaries. The real threat and the real threat at war that I have is between the neurological diseases that encompasses the world's patient population. Okay. What's interesting here is this gentleman, he is in the Rafah refugee camp. And even I think his med school was demolished. Um, and They have a hybrid med school now in the Rafah camp. And even with intermittent internet access, this gentleman was able to work and, in the name of science, push the boundaries of science forward. Um, in fact, my apologies. I did not. This is not the updated picture. This is. And interestingly, if I were to go here and show you this student, future doctor, medical student here in Gaza, in the refugee camp, under my guidance, I connected him with, he was able to be co-authored in a publication with the Global Neurosurgical Alliance, my nonprofit, with Harvard, with the Harvard professor I work with, Mayo Clinic. I'm helping and mentoring a spine fellow at Mayo Clinic to publish, and our beautiful University of Arizona. This is I'm very excited for this. We just got the news today, and I put this together, and I'll be sending this out on our Global Neurosurgical Alliance social media. But yeah, I just want to let you guys know, like, all the book sales that we've been getting. We have a top selling book we've been using to donate to our nonprofit that has ultimately been helping people. And I like this because I did the nonprofit for food program, and I help so many people with food. And I just want to let you guys show you here. If you go to YouTube, if you type in my name, Alan, if you type in my name. So this is me entering the examination room, listening to a patient X, Y, and Z. And then this is the nonprofit I was talking about. So this is the food program that we both started. But the thing is, guys, is the food program, it's great and all. I love it. We helped people from the military, veterans. For me, it was a practicing ground. A practicing ground that allowed me to build this nonprofit. I was helping these people. I was help feeding these people healthy, fresh produce. But I may have helped maybe a couple doctors, but these people were in the lower socioeconomic sector. Some of them helped out maybe maybe 2 to 3 people, give or take. But the impact of the help was good for the person, but it wasn't exponential. So what I'm trying to say is that I pivoted into helping physicians and medical students, because in the lifetime of this future doctor, hoping he does live a lifetime, given he is in a war zone, how many people and patients is he going to help versus me helping the community? I'm not saying helping the community is bad. I'm just saying, how many patients is this man going to help? 1,000, 2,000, right? 10,000, 20,000. I mean, I don't know. Let's see. How many patients does a family doctor see in their lifetime? These are honest questions. Mathematically, I would put the number close to 60,000 total visits in a lifetime of right? So I have over 500 members, 500 researchers that are physicians, 500 and some are future physicians times 60. That is 30 million. 30 million people. But you know what's different? The people that I'm helping are going to be surgeons, are going to be brain surgeons. You know how many lives they're going to save? So that is what I'm trying to do, right? So like why am I um talking about stocks and all this stuff? Well, if you look at the wealthiest people in the world, they all have something to do with Wall Street. They've all stepped in that damn building, right? And Benjamin Graham, it all goes back to Benjamin Graham. So, and we know that you have more money, you live longer, and you can afford better food. So ultimately, as I'm in the operating room in the future, I'm going to have the science part of my life, the Global Neurosurgical Alliance, training the next future physicians how to do research, and ultimately in the future clinically train them too. There'll be that avenue. Then I'll have our stock trades that's teaching people about intrinsic value and investing and having your money work for you. So that's overall kind of the thing I've been doing on that. I know, like, long explanation, but I just wanted to share with you kind of my vision and what I'm doing. Right. So I'm not just talk. I'm actually building what I'm doing. Right. We're building the future. Right. Just look at these authors. They're coming from Mount Sinai, which is a top 10 hospital in the world. There's the Global Neurosurgical Alliance. There's Arizona. There's University of Jordan. There's Pakistan. There's Iraq. There's London, right? It's crazy. Crazy how I was able to do all this by myself. It's not by myself. I have a team, but it's crazy how I thought of the idea and somehow it just worked itself out. It goes back to Denzel Washington's statement: anything good from the heart is God's proof sent beforehand to indicate that it's yours already. So with that said, Andrew Torrey's heart is in the right place. I didn't know this, but he suffers from Marfan syndrome, which is a deficiency in the gene fibrillin, which causes individuals to have different type of flexible manifestations. But the most deleterious is they could get aortic dissection and sometimes aortic problems too. So his heart is in the right place, and he's doing good. So I definitely hope that his ambitions pay out, and I think they will. So, all right, let's go ahead and let's do here. If you cannot hold a stock for a decade, you shouldn't be invested. I agree. Tired is part of a system of holding through these cycles. 25 will be the year regardless of first split. Agreed. Guys, don't buy any more Clover shares. The company's burning so much cash, and Clover is not profitable. They will not be profitable all the way up to they have less cash now. Okay, thank you, Tiger. Appreciate it. I appreciate it, Tiger. I love you. Thank you. If Clove is not profitable in the next 2 years, RS is all but guaranteed. I agree. If this happens, the odds of success for Clove public drastically decrease. Holding for 10 years would be irrelevant. Hey, man, I appreciate your opinion. In fact, actually, you comment here. With the Federal Reserve now limiting providing liquidity into the MA system, and revenues crashing, the Federal Reserve? You mean CMS? How can Clove attain sustainable profitability growth? I would Randy, I would take a look at what's been happening and potentially it might answer your question. Dude, tell Mr. Toy here to come on my boycast, honestly, right? Yeah, I mean, he honestly should. I mean, if he does come on my podcast, I don't want to ask him anything financially related. I want to focus it more on a healthcare discussion because with the SEC and all these things, because so we could I would love to focus it on the science, but he's pretty much said everything, so maybe I can ask him. He's done a good job at communicating. I have to agree. He's doing good. All right. Hope this was helpful, guys. I will see you on the next one.